Hello, I'm Dr. Dennis McKenna. As always, I'm joined by Dr. Fred Venditti, our hospital system general director, giving you the update from Albany Medical Center on the coronavirus. Today is Wednesday, May 27th. As always, we begin with numbers from the 8 counties in the capital region. Let's put up the graph. You can see from the vertical bars that things are about the same as yesterday. People who are currently admitted to hospitals in those counties is the same as yesterday. Today's 96, yesterday was 97, and those in the ICU remain the same, 10 on both days. If you look at the numbers inside here at Albany Medical Center, we had a good number of discharges yesterday. Our numbers are less than yesterday. We currently have 42 people in the hospital with COVID-19. We have 36 on the floor. We have 6 in the ICU. And Fred, I'll let you give the good news number on those on ventilators.
Dennis, that is 0. We have no patients on ventilators today. It's quite remarkable.
Right. So the last person who was on a ventilator has come off a ventilator.
They were extubated. They were taken off the ventilator. So Dennis, we've had a total of 78 patients on ventilators. 43 of them have survived, which is really quite good.
It is. In fact, if we look at the statistics, that compares favorably to national numbers.
So in New York City, they talk about a 20% survival rate. Our survival rate was over 50%.
Incredible.
Yes.
Credit to the incredible teams in our ICUs. Fred, in the 42 who are currently admitted to the hospital, we often like to give an update on congregate living facility. These are people primarily from nursing homes, group homes who are here.
So 42 total patients in-house. 34 of them are from congregate living facilities, so nursing homes, group homes, etc. So that means, Dennis, only 8 are from the general community. And of the 34, 10 of them are actually ready to go back home, but they continue to test positive, so they can't. They can't go back to their nursing home or group home.
And the 8 who are from the community, they're from this region. There's no downstate people in our hospital anymore.
That's right. We discharged the last New York City patient last week.
Speaking of numbers, we like at least once a week to update everybody on the status of healthcare workers who have tested positive for COVID-19. And Fred, I think you have 3 important numbers to look at.
That's right, Dennis. So we've tested over 1,000 healthcare workers, actually 1,006. Of those 1,000, 107 tested positive. And the vast majority of them acquired COVID in the community, not here in the institution. Of the 107, 98 have cleared, so they've gotten over their infection, they've been afebrile, no temperature, no symptoms for a number of days, and have been able to go back to work. And that's 98 of the 107.
Incredible.
So really very, very incredible.
All right, and again, that doesn't happen without the good work of our healthcare providers wearing the PPE, trying to protect themselves, and our epidemiology team who follows up on every positive case.
And that 10% number, so 107 out of 1,006, is a percentage that's basically the same as the county percentage of positive tests, about 10%.
So we'll continue to track that. It's been a while since we've had a healthcare worker test positive, and we'll keep an eye on that as we go forward.
Very important.
Fred, you mentioned avoidable days, or you were talking about people from nursing homes in the hospital. Let's take a minute and talk about what this number means. If you are admitted to the hospital, generally we say that you are medically acute. That means that we're actively treating you with medications or things that are provided in a hospital. And you reach a point when you no longer need the services of a hospital and you're ready to be discharged. And typically you're discharged to home, you might go to rehab, or in some cases you might go to a nursing home. The day in which you are no longer needing the services of a hospital and you're ready to be discharged, we say you're no longer medically acute.
That's right.
And historically we've said from that day forward, if you stay in the hospital, those are what we've called avoidable days, meaning you could avoid them being in the hospital if the circumstances that allowed you to be discharged were met. Insurance authorization or an available bed in a nursing home. So this term avoidable day is one that we've used in the past.
Yes, Dennis. So we always have avoidable days. There are always circumstances where a patient's medically stable enough to go home but can't for some reason, as you say, awaiting insurance verification for a nursing home placement as an example.
And now we're living in an environment where there's a new category of avoidable days, and these are people who are no longer medically acute. Well, often they came from a nursing home. They remain COVID-19 positive by lab tests, but they're not acutely ill. And so they're remaining here. And you've talked about this, and the number of days is something that we're tracking.
That's right, Dennis. So as I said before when we were talking about the numbers, there are 10 patients who came from nursing homes who are positive still for COVID, even though they're not acutely ill, but they can't go back to the nursing home because of the rule set that exists.
Right.
There are also a number of patients in the hospital who've had other illnesses, not COVID necessarily, who need to go to a skilled nursing facility, a nursing home, or rehab, who can't because those facilities aren't taking new patients right now because of COVID in the community. And so those patients are generating, if you will, avoidable days as well. So two categories that we don't normally see.
And we've talked about this, but as the hospital director, you've been asked to make sure that we don't go above a certain threshold of capacity.
That's right.
And the number they talk about is 70%. And it's important for us to be careful stewards of our bed. So as we're holding on to patients in the hospital who no longer need hospital services, it does create some dynamic where we have to titrate what we can take care of in the hospital.
That's right, Dennis. And so if there are 10 patients today and 15 patients tomorrow and 20 patients the next day who are positive, can't go back to their nursing homes, but aren't acutely ill, that then drives our census up and gets us closer to that 70% number. So it's a problem.
Yeah. And just one more point to remind ourselves, we've talked about this, the reason why some of these patients who are no longer actively being treated for COVID-19 continue to test positive is because the results of the test often remain positive long after the patient is sick.
That's right. So Dennis, we've now tested 28 congregate living patients who were COVID positive looking for antibodies.
Right.
Of the 28, 26 have antibodies. Now that would suggest that they're in the convalescent stage, that they're no longer actively infected, that they don't have live virus to shed, but yet they can't go.
And I think we would make the case it would be safe to return them to the nursing facility.
I think it would be safe, absolutely.
Okay, very good. One last topic is, and we've been asked this a couple times now, is are we seeing evidence or will we know evidence of a second wave coming? So let's talk about that a little bit. We've put into place many processes that we think are durable. The way in which that we care for not only the patients in the hospital, but the way in which we protect our staff with PPE. As the upcoming flu season happens, typically in the fall and early winter, those processes that we put in for COVID will also help for flu.
Absolutely.
So this is good. But we also look at data on a very regular basis. And there's no evidence today that we're seeing any uptick in cases. And if there were going to be an uptick, we would know well in advance. We would start to see that go up. So right now, no evidence of a second wave.
None whatsoever. As a matter of fact, quite the opposite, Dennis. So in the press, people have probably heard about something called the R-naught. And really what that is if you're infected with COVID, how many other people can you infect? So if the R-naught is 2, then you would infect 2 other people, and that's how it can multiply and really grow exponentially. So that's something that's being tracked. And in point of fact, there was an article today about R-naught by state, and there are states where the R-naught is above 1, which means the epidemic is growing. But it turns out New York State's R-naught is less than 1, and actually substantially less.
Good.
It's actually 0.82. So that means that the number of people infected is actually declining. And so clearly we're not in a second wave. Clearly we're on the downslope of the first wave. And that's I think due to all the good things that people have done in the community as well as in institutions like ours to try to prevent the spread of the virus.
And there's no question that there's nobody more interested in making sure that if there was a second wave, we would know about it, and we would be the first to report that if we saw that coming.
Dennis, you and I are numbers guys, right?
Right.
What's the first thing we look at in the morning?
Data.
The numbers, data.
For sure.
And that's the number of new cases for me and what's happening in the hospital, et cetera. So we're on top of this.
Very good. Last thing, it's Wednesday night, so we'll have another virtual journal club, and I think tonight's topic is non-pharmacologic treatment for COVID. Should be very interesting.
Very interesting, yes. I'm looking forward to this one. I think this is about epidemiologic and public health approaches to dealing with the infection.
So we'll update that tomorrow. We know medical students are working on preparing that, and we'll tell you what we learned tomorrow.
Yes.
All right, very good. That'll do it for today. We'll be back again tomorrow. Once again, we ask that you please take care of yourself, take care of each other, and we'll see you tomorrow.